And welcome back, everybody. Our next guest is a local recovery coordinator with the VA Medical Center in the Bronx and joins us for a look at their work. Well, we welcome Efrion Smith to the show. Efrion, welcome.
Thank you.
Now, you're doing some great works over at the VA hospital. Tell us about it.
Yes, we're preparing for our local mental health recovery summit, which is going to be September 12th. And the summit is focused on bringing information about mental health recovery to our community providers. So it's something that the VA has been doing for the past 5 years, and it's an opportunity for the VA to engage providers and bring them into our facilities so that they can learn more about service to veterans.
Mental health recovery. Explain it.
Yes. So mental health recovery is just helping people to understand that sometimes we do have issues where we might need to get some information or get some services to treat something that we're having as it relates to our mental health, our mental well-being. So what we do is we have clinicians that are at the VA that provide certain mental health services to veterans for a host of diagnoses. And the summit is a way to provide information to community members as well as providers so that they can treat veterans according to those diagnoses.
PTSD, and
Yes.
a lot of people come in for that.
PTSD, depression, anxiety, adjustment disorder. For veterans coming back from the military, it's an adjustment. So sometimes you need somebody to help with that adjustment. And that's what we do at the Bronx VA.
What things are in place to help with that?
Like I said, we have what's called same-day access. So if a veteran comes into a hospital today and is experiencing some medical issues, they can receive services the same day for those medical issues. If they're having some mental health issues where they feel depressed or they don't know what to do about a particular issue, they can see somebody the same day. And we also have our Veterans Crisis Hotline, which veterans and veterans families can call 24 hours, 7 days a week, and they can get referrals and information on how to help the veteran or the family member.
How can the public help with our veterans and help with some of the things that you guys are doing at the hospital?
Well, one way is for community providers to come to the Mental Health Summit so that they can learn about the services that we're providing to veterans, and so that they can take the information back to their organizations and they can provide that information to the people that they serve. Because a lot of times we realize that a lot of organizations serve veteran families, but they're unaware. So if they have the information, they can provide that information to the family members.
Tell us more about the Community Health Summit.
So the Mental Health Summit, we're going to have various speakers. It's an all-day event. It's from 9 to 3. And like I said, we're inviting community providers to participate. We'll have Dr. Daniel Coleman, who will be speaking about the role of masculinity as it relates to suicidal behavior. We have a gentleman by the name of Brett Scudder, who's actually a survivor of suicide attempts, who will be talking about the emotional pain that people who try to commit suicide have, and how for clinicians to best engage those people. And then we'll have some family organizations like NAMI, Blue Star Families, and we have our veterans caregiver program there.
Are they doing anything about the transgender situation in the military?
Yes, we have services. The VA, we don't discriminate against anybody's sexual preference. So we have services in place for LGBTQ veterans as well in our facility. They receive mental health services, they receive medical services, and we have policies in place in the VA to make sure that people are treated fairly.
All right, what's the date of this mental health summit?
It's going
to be at the VA hospital?
It's going to be at the J.J. Peters VA Medical Center on Kingsbridge. It's going to be September the 12th from 9 to 3.
All right, and you're going to be there?
Yes, I will be.
Now, how's it going to look? There's going to be booths. Can people get screenings and things like that?
No, so there won't be any screenings. What we'll do is we'll have a list of different speakers, and we'll have some organizations that will actually provide their information so people can get information, and there'll be opportunity for people to network. So if you're dealing with a particular issue, or you can connect with somebody, or you want to connect with an organization around a particular issue, you can connect in that way.
Yeah. Now, there's been issues over the years about veteran services. What would you like to see? Would you like to see any changes or anything like that, or something modified?
I think, as it relates to mental health, I think there's always a shortage in services. But I think that we're doing a good job. Like I said, we have our same-day access initiative. Yeah. So that's a way to cut down the wait time. So instead of a veteran waiting 2 or 3 weeks, they can see somebody the same day to address their mental health issues. So I think we're doing a good job in that respect.
Did we leave anything out? Anything you would like to add to this conversation?
I just think that, you know, we need to just honor our veterans by all the things that we're doing in our community. And I think by participating in this event, you'll really get to learn how you can best serve veterans because they're complex individuals.
Are you a vet?
No, I'm not a vet, but I have
You
family
work with
members who are veterans.
Yeah, there you
Yes.
go. We want to thank all of our service members. Thank you for your service. Thank you very much. And we appreciate all the wonderful work that you guys are doing at the VA hospital. And we'll look forward to seeing what you got. Can you come back and share the information from the mental health summit?
Of course we can.
Yeah.
Yes.
All right, so get some videotapes, some pictures, and we'll hook it up in the background. We'll talk again.
Okay.
All right. Give him a big round of applause, everybody. Efrion Smith, Local Recovery Coordinator, J.J. Peters, VA Medical Center. Thank you, sir.
Thank you.
All right. We have to take a quick break right here, but stay tuned. We'll be right back with more Open next.